Well, flu season is in full swing, and here to tell us how to take care of ourselves during it is Dr. Cameron Nouri. He's an emergency room doctor at Dignity Health Community Hospital of San Bernardino. Welcome.
Thank you.
So are we in flu season? When did it actually start?
Yes, congratulations. You are exact. You're in it. Typically, the flu season in our part of the world starts around October and goes all the way to May of each year. So that's pretty much what we call a flu season.
Okay, and so most of us should have gotten our flu shots already?
I would certainly recommend. Keep in mind that it takes about 2 to 4 weeks for the flu vaccine to be effective. Therefore, we really recommend early fall, October. Get it. However, it's not too late yet.
Okay, and everybody should get it, in your opinion?
I really recommend everyone, with few minor exceptions who have allergies to it or certain people that have had certain illnesses. Otherwise, everyone should get it 6 months and above.
Okay. Now, I noticed around our newsroom there's a cold going around, but how can people really tell if they've got the flu or a cold?
If you come up with a good way, let me know too. Really, I mean, the symptoms are very much alike. You know, they're both upper respiratory infections, and they both, they involve, sore throat, cold, cough, things like that. However, in general, flu symptoms are much more intense. You are getting a higher fever, you have body aches. And certainly the thing to think about with the flu is that it involves a lot more complications and serious complications. Now, cold usually is benign.
Is there any difference in how long they last?
Typically, a flu can last a bit longer. Particularly the general malaise or just not feeling well, and the body ache is really what dissociates the two between, and you can actually, kind of determined, but they're really, I mean, clinically there isn't that much of a difference.
Okay, and what are some treatment options for those of us who might end up getting the flu?
Hydration, obviously treatment in these cases for most of us who don't have any serious medical conditions, such as elderly with cardiovascular disease and such. If you're otherwise a healthy person and you come down with the flu, it's supportive treatment. Over-the-counter medications are just as good. Now, there are some treatments, antiviral treatments, that are available. However, the use of them are only limited to the early parts of your disease when it's diagnosed within the first day or two. And quite frankly, all they do is that they shorten the period of time by very little, and they might actually have milder symptoms. But for most part, symptomatic treatment. If you have a fever, take whatever you take for a fever, Motrin, Tylenol, whatever you might take, and keep hydrated. Okay,
and stay in bed and away from the rest of the family.
Yes. Yeah. I would do that even if I didn't have it.
Yeah. At what point though would you say, okay, you need to go to the emergency room?
Right. As I said, with flu, we always worry about the extreme of age, the very young and the very old. Anybody who has serious cardiovascular disease, such as what we call COPD or emphysema, heart disease, those people have to be very careful. Pregnant women have to be careful because of the physiological changes that happens with pregnancy. They certainly should be careful as soon as they're not feeling well. Obviously, anybody who cannot keep hydrated and the fever doesn't come down, they should seek help.
Okay. And when I always get confused on how high the fever needs to be. At what point is that fever so high that you need to go?
Well, first of all, we define fever at 100.4 and above.
Okay.
So when you start, a lot of people come in and they say they have, tactile fevers, and they really didn't measure it. So it's very helpful if they did. However, I have to say, with moms, it's usually very accurate. When they tell you that a kid has a fever, they do. Any temperature above 103 we worry about, 104, 105, certainly those things worry about. You certainly would see it clinically. The person would be very lethargic, would be feeling extremely not well. Again, be very cautious with the very young because they can't tell you exactly how they feel.
Exactly. All right, doctor, thank you so much
for
joining us this morning. And for more about Dignity Health and its network of local hospitals, just go to our website, kcal9.com, and click Seen on TV.